Hello, everyone, and welcome to Frontier's presentation, Creating a Culture of Caring, as we celebrate National Nurse Practitioner Week. I want to wish each of you a happy Nurse Practitioner Week. My name is Paula Alexander Delpeche, and I am a board-certified psych mental health nurse practitioner. I teach in the psych mental health nurse practitioner program here at Frontier Nursing University. My presentation is titled Advanced Practice Nurses Adopting a Health Equity Lens. The objectives for my presentation are very few, 3 of them: to discuss why there's a need for nurse practitioners to adapt a health equity lens, to discuss strategies nurse practitioners can use to address health inequalities, and to discuss the impact of nurse practitioners on health outcomes. I begin my presentation today with a quote from Helen Keller that says, "I am only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something." I use this as my opening to set the tone for my presentation. As a group, we can certainly do things individually and collectively. There's copious amount of research that addresses the issues of why, as a society, we continue to have poor health outcomes, considering that as an industrialist country, we spend more money on healthcare than any other industrialized nation. However, we often lack the tools that teaches us how to solve that issue. My goal today is to speak to nurse practitioners who are working at the point of care, the gatekeepers of the client-patient relationship. The purpose of my presentation is to provide you with helpful tools that you can use in your practice. So why is there a need for nurse practitioners to adopt a health equity lens? In 2003, the National Academies of Sciences, Engineering, and Medicine, formerly known as the Institute of Medicine, in their landmark report on equal treatment, confronting racial and ethnic disparity in healthcare, found that there's evidence that racial and ethnic disparities in healthcare consistently cross a range of illnesses and health services. The following year, in 2004, the Sullivan Commission report titled Missing Persons, Minorities in the Health Profession. The Sullivan report highlights the stagnation and imbalance in diversity of the nation's physicians, dentists, and nurses. It proposed new approaches and new models for making the health profession workforce more diverse to improve the overall health of our nation. Most recently, the National Academies of Sciences, Engineering, and Medicine report The Future of Nursing 2020 to 2030, charting a path to achieving health equity. This report explores how nurses can work to reduce health disparities and promote health equity. Additionally, we have two national organizations, the National Association for Nurse Practitioners Faculty, the American Association of Nurse Practitioners, calling for decisive actions to promote an equitable future for all citizens. So as you can see, there's a theme here calling upon us as nurse practitioners to improve the health of our nation. So when we call for an action, we usually identify the root cause. So I wanted to share this picture of Dr. Desmond Tutu with you and to talk about this famous quote that he made in 1984. In 1984, the day that he received news that he got the Nobel Prize. He was talking to Jane Hansen, the award-winning journalist who is credited for the first person to report the Twin Towers being struck by an airplane on 9/11. And at that interview, she talked about how Desmond Tutu talked about perseverance, hope, and never giving up. And that's what I think about nurse practitioners as we think about adopting a health equity lens. Desmond Tutu said, we need to stop just pulling people out of the river. We need to go upstream and find out why they are falling in. So let's talk about some sources of disparities. It stands to reason that there are gaps in our healthcare system, and strengthening the healthcare system is essential to the health of our nation and promoting access to healthcare. We know that there continues to be persistent racial disparities in health coverage, chronic health conditions, mental health, and mortality. Health disparities are often driven by social and economic inequalities, as displayed on this image in front of you. Social and economic factors drive health outcomes. And when we talk about social and economic factors, we are talking about economic stability. We are talking about neighborhoods and physical environments and education. We are talking about food, community and social context, and also the healthcare system and how those factors can impact health outcomes, mortality and morbidity, life expectancies, healthcare expenditure, health status, and functional limitation. And as you look at this image, you also see that racism and discrimination are threaded through all of these factors. There's also increasing evidence that the social determinants of health, which the World Health Organization defines as societal, environment, and economic conditions that impact and have an effect on health outcomes. And they are primarily responsible for the well-documented health inequalities seen among various racial and ethnic population groups in the United States. Research have also suggested that social determinants of health are the primary drivers of health outcomes, despite the lack of evidence to determine which factors outweighs which. According to Healthy People 2020 and 2030, social determinants of health are conditions in the environments where people work, people live, where people are born, where people worship, where people age, and these factors can affect a wide range of health functioning and quality of life outcomes and risks. So what are considered social determinants of health? There are 5 categories that are considered social determinants of health. They are education, access and quality, economic stability, social and community context, neighborhood and built environment, and health access and quality of health access. But today, as future nurse practitioners and current nurse practitioners, we cannot talk about health outcomes unless we discuss structural racism, which is sometimes referred to as institutional racism. According to the Aspen Institute, structural racism allows us to provide dimensions of our history and culture that have allowed privilege associated with whiteness and disadvantages associated with color to endure and adapt over time. Structural racism allows us to approach solutions to health disparity within a system lens. The Aspen Institute defines structural racism as a system in which public policies, institutional practices, cultural representation, and other norms work in various, often reinforcing ways to perpetuate racial group inequalities. So what can we do as advanced practice nurses? We can understand how race, ethnicity, geographic, education, and income impact one's access to health services. We can recognize and take action to overcome factors that have fostered health inequalities. We can address how disparities continues to be played out in our society. And finally, we must be the change we want to see in the world. So how do we begin? So I'm here to tell you that we can begin by being an ally. Becoming an ally is a good starting place. Most of my colleagues and friends from the dominant culture often ask, Paula, how do I become an ally? At first, I did not know how to respond. However, with much work and thinking about it, intentionally thinking about it, I realized that allyship is not a noun. It is not an identity. It is not a label or something to claim. It's about taking action, taking a stand, doing something to make a difference by standing up. To be an ally is to be recognized by someone else. So here are my 9 tips to allyship. Do your research before you ask questions. Practice active listening. Amplify the voice of others. So many times, members of marginalized or underserved groups do not have a voice. And if you have a voice, you ought to amplify the voice of others. Understand your own biases. Apologize when you make a mistake, because mistakes do happen, but you have to be able to apologize and recognize when you make a mistake. Dig deeper to understand the impact of identity. Don't take people's identity for granted. Know that systemic oppression exists. Think about how you can be an ally in all areas of your life, not only professionally, but also socially, because we are mothers, we are fathers, we are brothers, we are sisters, we are community members. So think about how you can be an ally in all facets of your life. And the last thing is, be prepared to do the work, because the work is rewarding and gratifying. So prepare to do the work. I also want to share this model with you. This is being adapted from Dr. Lois' work as a master facilitator. He uses the scale model when he is teaching people to be facilitators of brave conversations. But I am going to use it today as a way of emphasizing the role of the nurse practitioner as a provider, as an educator, and as a scholar. And the scale model starts with setting the tone. Realize that as a provider, it is your responsibility to build trust. Building trust is conditional on the nurse practitioner's ability to make time in his or her busy environment to establish a rapport with their patient. The second one, create community. Create space. Base your interaction on the person or persons in front of you, not on preconceived notions or not on stereotypes. As nurse practitioners, we must be aware of our blink. According to Malcolm Gladwell in his book, Blink, every one of us has biases. However, we must realize our biases so that it does not hinder our decisions as it relates to our clients or our students. Number 3, create community. Be aware of the community in which you practice. Know about community resources. Know about how you connect your patients to local resources. Connect the stories of your patients or your clients. Listen to the stories of your clients. Taking time to listen to your clients can result in building trust. Communication skills. There's not much I can say about communication skills because as nurses, we focus on therapeutic communication, and so we want to be able to maximize our communication skills and be aware of verbal cues from our students and also from our clients. Number 6, being authentic. If you're from the dominant culture, you need to be aware of privilege. And if you're a person of color, be mindful of class distinction. Number 7, lived experience. Recognize that each of us have a lived experience and recognize that each lived experience is different. And lastly, in the middle of the model is embrace empathy. Understanding the feelings of the other person. Empathy is the hallmark of the nursing profession. And so as you engage with others, you want to embrace empathy. So now I would like to spend some time by talking about 3 case studies that demonstrates the scale model and how the scale model was used and how it could be used in certain circumstances. So the first case is about a 24-year-old woman with severe mental illness living in a group home and has been seen by several doctors to be put on birth control without success over several years. At this particular visit with the nurse midwife, before the visit, her guardian was asked to remain outside of the interview so that the client's privacy could be honored. At the beginning of the interview, the client was very shut down and stayed under her hood. The nurse midwife gave her space, and then she began to tell her story to the nurse midwife. She told the nurse midwife about her fears and misgiving about birth control. The nurse midwife took her time to listen to the client's story. Then the nurse midwife made one statement to the client, and she said, "It sounds like you do not feel like you are in a safe situation. Do you think you would like to bring a baby in these circumstances?" The client pondered, and then the client said to the nurse midwife, "No, I do not want to. I would like to have an IUD." In this situation, the nurse midwife allowed the client to feel safe. She gave her space. She used silence. She listened to the client. And eventually, the client was the one that made the decision about the choice of birth control that she wanted to use. And again, it's about building that trust with our clients. The second case study I would like to discuss is about Maya. Maya is a 35-year-old healthy Black woman with a family history of breast cancer. Her mother died of breast cancer at age 38 years old, and her maternal aunt died of breast cancer at age 45. Maya consistently reports her cancer family history and intake form she completes at routine visits. Recently, Maya read a news article about BRCA1 and BRCA2 genetic testing. So on her next visit to her primary care doctor, Maya asked to be tested for BRCA1 and BRCA2. Maya was told that she did not need to worry about these tests. The only people who ever come back positive for those tests are Jewish ladies. The response was that genetic testing is not necessary for Maya. So here we have a situation where the primary care provider did not listen to Maya and did not offer any help to the client, not knowing that white women are likely to be diagnosed with breast cancer at a higher rate. However, women of African descent are more likely to die from the disease. Breast cancer death rates are 49% higher for Black women than white women in every state of the United States. So taking the time to listen to our clients and getting some information as it relates to statistics could help us as it relates to health equity. The last case study I would like to discuss is Mrs. Smith, a 56-year-old African-American woman who is constantly followed by her FNP for her blood pressure and her blood sugar. Most of the times, Mrs. Smith's blood pressure is under control and her A1C is within normal. But recently, Mrs. Smith's blood pressure was very high and her A1C was also very high. The family nurse practitioner who always see Mrs. Smith began to accuse Mrs. Smith of not following her diet and not listening to the plan of care. Mrs. Smith left the office that day feeling very unworthy and very not trustworthy as it relates to what she was told by her FNP. Had the FNP taken the time to listen to Mrs. Smith, she would have known that Mrs. Smith has a 19-year-old grandson who she just bought a car for, and she's always worried about him driving because he was just accepted into college and he has to drive about an hour to college and an hour back home. And she's always worried that he would be stopped by the police. And as a result of that, Mrs. Smith's blood pressure has gone up and her blood sugar has gone up. But had the FNP taken the opportunity to listen to her story, he or she would have known that there are other factors that could lead to the increase in her blood pressure and the increase in her blood sugar. In addition to the cases that I shared with you, I would also like to share some resources. I do think that we all should have resources that we can go back to. And the two I want to share is a book by Dr. Cooper that talks about why are health disparities everyone's problem. In this book, Dr. Cooper reveals in detail how health disparities are crippling our health system and society, how it's driving up health costs, and it leads to adverse health outcomes, and ultimately, it leads to enormous burden of health suffering. The other book that I would like to share with you is by Dr. Trotter, More Than Medicine. In this book, Dr. Trotter talks about the work of nurse practitioners and how they are working in the front lines to cure America's healthcare crisis. So we talked about the why, we talked about resources, and now I want to spend a little bit of time talking about who are we? Why is it so important for us to adopt a health equity lens? When I say we, I mean nurse practitioners. So I want to just give a bit of history as it relates to the beginning of the nurse practitioner role. The nurse practitioner role was created in 1960 by Dr. Loretta Ford and Dr. Henry Silver in Colorado. The nurse practitioner role was created out of a need to increase patient access to pediatric care. Although the role started off as a way of increasing access to care for pediatric patients, according to Dr. Ford, today, nurse practitioners are a force to reckon with because as a group, we can solve what troubles the country's access to healthcare. There are more than 325,000 nurse practitioners licensed in the United States. Almost 89% of NPs are certified in the area of primary care, and we know that there's a shortage of primary care doctors, and there's a shortage of primary care providers. 1/3 of all NP practice in a hospital. Almost 93% of NPs prescribe medication. NPs in full-time practice write an average of 21 prescriptions per year. And 60% of NPs see 3 or more patients per year. That is impactful as it relates to who we are and what are we doing as it relates to healthcare. As a group, we are also very highly qualified. 84% of all nurse practitioners have a master's degree as an initial degree. 18% has a DNP as a terminal degree, and 2% have a PhD as a terminal degree. So how do we impact healthcare? In a review of the literature, it showed that the quality of care by advanced practice nurses is comparable to that of physicians. Advanced practice nurses were better with communication and management of chronic health conditions. Advanced practice nurses reduces hospitalization from long-term care facilities. Adding NPs as complementary roles in a hospital lower mortality and frequency of transfer to intensive care units. States with full practice of NPs have lower hospitalization rates. and obstacles to full scope of advanced practice have the potential to negatively impact the health of our nation. So nurse practitioners are impacting healthcare. And so back to the title of the presentation, with this impact that we have in healthcare, we need to begin to adopt an equity lens so that we can narrow the healthcare disparity gap. I'm sure that most of you have seen this image before. So in closing, I want to just mention that this is the result that we are seeking. We want to move from equality to equity, where everyone is given the opportunity to have access to healthcare. But most importantly, we want to move to liberation. We want to take down the barriers. We don't want to have any barriers as it relates to healthcare. We want every person to have access to healthcare. Dr. Martin Luther King once said, of all forms of inequality, injustice in healthcare is the most shocking and most inhumane. And so we want no barriers to healthcare. We want everyone to have access to healthcare. And in closing, I would like to share this video by Lee Myung-won, the famous movie maker and talk show host and producer. In one of his YouTube presentation, he talked about the secret of changing the world. And he tells a story about a high school friend and an interaction that occurred between the both of them. And in the end, he talks about for each of us to change the world, that we must take the time to walk each other home. Please listen to this 2 minutes video by Lee Myung-won.
It was a story that I remember quite well when I finished high school. I graduated as the president of Oakland High. And one of my best friends said to me, "Manoir, why don't you come on home with me?" And he was black. And I went, because my father told me never to go into a black neighborhood. And I said, okay. So we kind of dragged my feet along. And as we were dragging, he goes, "Manoir, catch up with me." And I said, okay, Donald, okay. But I was really scared out of my mind of what might happen to me. And as we were walking along, what I realized to Don, what I said was, "You know, Don, I know this neighborhood." And as we got closer, I said, "I grew up in this neighborhood. In fact, this is the same block that I was born in." And Don said, "Wow, what a coincidence." And then we started to walk up to his house, and guess what? The house that he lived in was the house that I was born in. And I looked at Don with tears in my eyes, and I said, "You know, Don, you were inviting me into your home where you were never welcomed, and I was told never to bring you home." And what I'd like to do is to tell you this today, that perhaps that is the secret to changing the world, that each and every one of us has to take the time to walk each other home. I thank you.
I want to thank each of you again. Happy Nurse Practitioners Week. And here's my references. Thank you.